Hello, my name is Jeanette Archinall and I'm a doctor at Cornerstone Family Practice here in Burlington, and I'm here today to talk about women and stroke prevention. So there are two main reasons why I think stroke prevention is an important topic, specifically for women. And the first, I think, is something we sometimes don't think about, and that's that if a family member has a stroke, it's invariably the women who end up taking care of that person. And I think that's one very important aspect of stroke that we don't pay attention to. But the second really important reason for talking about women and trying to prevent stroke is that women have more strokes than men. And if we have a stroke, we're more likely to die in the first 12 months after that stroke than is a man the same age with the same health conditions. We use the word stroke a lot, but I think it's important that we all know what we're talking about when we talk about a stroke. But basically, a stroke is interruption of blood supply to the brain tissue occurring long enough to actually kill off some of that brain tissue. The ones where the blood supply shuts off briefly but doesn't kill brain is better known as a TIA, which again, I'm sure most of you have heard that term, transient ischemic attack, so brief period of time with no blood supply. There are two main causes of interruption of that blood supply. One is if there's a blockage in the artery, so the actual blood carrying oxygen can't get to the brain tissue. And the other is if the blood flows outside the artery rather than inside. If we're talking about blockage of the blood supply, that's due to anything that's going to stop that blood flowing. So it can be by a blood clot, and that blood clot can be just a clot of blood, or it can be a blood clot of cholesterol, or sometimes it can actually just be because the artery spasms down and closes off that blood flow long enough to kill the brain tissue. Now, the second type of stroke, which is the hemorrhagic stroke, is when the blood vessel bursts so that blood flows out of the artery instead of flowing to the brain. The difference is important from a medical point of view in terms of how we treat, but it's also important in terms of what causes it, because that goes to how do we prevent it. The main cause of the hemorrhagic stroke, the one where the artery bursts, is high blood pressure, far and away. The main causes of the other one, the blood clot, high blood pressure certainly can be part of it because it can cause chronic damage to the artery and cause clots. But the other two really big factors are diabetes and high cholesterol. So almost everything we're going to talk about with preventing stroke also works for preventing heart disease. Stroke is actually the third leading cause of death in the United States. It is the leading cause of disability in the United States. Heart attacks don't disable us the way strokes do. Every 45 seconds, somebody in the US has a stroke. So that's about 800,000 strokes per year. Most of these strokes, 3/4 of them, happen in people who've never had a stroke before. 1/4 of them happen in people who had strokes before but have not managed to control their risk factors, or their risk factors were so advanced at the time of the first stroke that there wasn't much they could do about it. 25% of women die in that first year after having a stroke. In fact, our risk of strokes actually doubles every year over the age of 55. 3/4 of strokes occur in people over the age of 65. Of those 600,000 people who live through their stroke, a good 5,000 to 6,000 people become permanently disabled. African American women, thought we had a couple, yes. Unfortunately, more likely to die of stroke than Caucasian. Smokers are twice as likely to have a stroke as non-smokers. Anybody know what a normal blood pressure is? The number, believe it or not, actually depends on your other health factors. If you're diabetic, your systolic, that top number, should be below 130 and ideally 125 or less, with the bottom number 75 or less. We treat high blood pressure if it's consistently 140 or above or 90 or above. But our risk of heart disease and stroke starts going up once our blood pressure is above 130/80. High cholesterol is a big problem. There are lots of reasons why we have high cholesterol. Genetics, because we inherit the enzymes that digest cholesterol and that make it. How much exercise we do, and what we eat. Cholesterol, again, varies depending on your other risk factors. Generally, in women, we want the good cholesterol, the HDL, to be 50 or above. It's different for men. 40 or above seems to be okay for men. We need the protection of that good cholesterol. If you're diabetic, your LDL, your bad cholesterol, needs to be below 100 and ideally below 80. If you have absolutely no other risk factors in the world, including nobody in your family ever had a heart attack or a stroke, under 160. For everybody else, which is most of us, 130 or less is our goal for the bad cholesterol. Diabetes, other big risk factor. If anybody in the room is diabetic, I'm sure you all know your hemoglobin A1C, which is the 3-month average of your blood sugars. The goal is 6.5 or less, and if you can keep it at that, you will reduce your risk of stroke and heart attack. A couple of other things. Atrial fibrillation. Basically what it means is that the heart, instead of pumping beautifully like this, does a little bit of this. When it does this, you can get blood clots developing around the valves in the heart, and that's that blood clot that can shoot off to the brain. So if you have atrial fibrillation and your doctor has said you need to be on a medication to control it, or take Coumadin to make your blood thinner, do it. The risk of a stroke is so much higher than any risks associated with the medication. Specifically to women, there are some clotting problems that we are more prone to, and those are mostly genetic problems which are triggered by estrogen. So hormone replacement therapy. I'm sure you're all aware of the findings of the Women's Health Initiative that a lot of the work was done at Chapel Hill, and that talked about the risk of breast cancer with hormone replacement therapy. The blood clot risk is also very high with hormone replacement therapy. If anybody here has migraine or knows somebody, you'll notice that one of the questions doctors ask is, do you get any flashing lights before you have your headache? Or sometimes you'll have had that and think it's an eye problem, and you go to your eye doctor and they say, oh no, you had a migraine. If you get that visual stuff before your migraine, or even if that's the only part of your migraine, make sure you're taking an aspirin a day. A baby aspirin is enough. But women who get aura with migraine, unlike men, are at increased risk of stroke. So, how do we know if we're having a stroke? Basically, I always think of a potential stroke as any unexplained neurological symptom. Anything, any weakness, not of the whole body, because we all have days like that where we feel we're just worn out. But if one arm or one leg or the side of the face or the tongue is weak, so localized weakness. Numbness. Now, people mean different things by the word numbness. What I mean here is total lack of feeling, abnormal feeling, or that that pins and needles feeling you get when you've fallen asleep on your elbow or leant on it too long. If you get that in one part of the body for no reason, that's a potential sign of a stroke. Severe headache, the worst headache of your life. It can be a warning that you're about to have a stroke, and that's that sort where the blood vessel's about to burst. Passing out for no reason. And the other is sudden problems with your vision or with your speech. If you're talking to somebody and having a conversation and the person you're talking to starts making no sense with their words, they're still talking, there's no weakness, but the words that are coming out make no sense, that person could be having a stroke. You call 911 and you go to the emergency room. You don't call your doctor, because trust me, you call your doctor's office, we're going to say, call 911 and go to the emergency room. The reason you need to go to the hospital isn't the death thing, it's the disability thing. The things we do in the emergency room, the really critical thing is a CAT scan. That'll tell us, did you have the blood clot sort of stroke or did you have the bleed? Because if you had the blood clot sort, we can give you stuff that's going to break up that blood clot. And if we can break up that blood clot quickly enough, you're not going to have dead brain tissue. It'll be the equivalent of just having had that spasm. You've got to be in the emergency room and treated within 3 hours for that to work, and preferably within 90 minutes. If it's a bleed, the key to preventing disability is getting that blood pressure under control immediately. Because generally if you've had a bleed, it's because your blood pressure has spiked, has broken that blood vessel. But that's why we do the CAT scan, because if we gave you drugs to break up clots and thin your blood, and you'd had a bleed, we're going to make it worse. Bottom line, how do we prevent? Stop smoking, get our cholesterol down, get our blood pressure under control, and that means getting it to goal, not just better than it was. Getting weight down makes a difference. A healthy body mass index, which is the relationship between height and weight, is between about 20 and 25. 20 minutes of brisk walking a day. It's all it takes. That can reduce your risk of stroke by about 30%. Improve our diet. Increasing the antioxidants in your diet, not by taking supplements, but through eating more fruits and vegetables, whole grains, green tea, preferably not sweetened, and believe it or not, dark chocolate, one of my favorite things, can reduce the risk of stroke by about 17%. Raisins, again, are good. Bananas are good. They all are good sources of potassium. Pineapples are actually also another good source of potassium, and so are apricots. Get enough sleep. We're learning more and more about what lack of sleep does to our health. Between 7 and 9 hours is what we should all be aiming for. And the final thing, and this is a plug for those of us in primary care, if we ask you to take something, please take it. Think fast. F being for any abnormality in the face, uneven smile, droopy eyelids, numbness, vision disturbance, speech disturbance. A for arm and leg, if you get weakness or numbness of the arm or leg. S for the speech particularly, slurred, wrong words, unable to speak. And T is for time, call 911, the Reynolds risk score. And the nice thing about it is you can just plug in your height, your weight, your blood pressure. I think it takes cholesterol into account. It also asks for a high sensitive C-reactive protein, which most of you probably haven't had done. I haven't had it done. But the average is less than 3, so put 3 in.